Hey, front
And
and center.
so, welcome everyone to the Doctor's Edition. Hope you all had an amazing Tuesday. And we are going to go on ahead and get started because I am not the last one today, so I cannot go over my time. So, thank you for joining us. I am going to get right to it. Let me go on ahead and share my screen. I would like to say that Dr. Rita is going to be back with us soon. And in agreeing to doing this, I was kind of like, okay, I have a whole bunch of things going on. And Dr. Rita said, why don't you just go back and do the one you did before since it was good? And I don't mind answering questions about diabetes and CBD and how it can help. I figured what I could do today, though, is give you a recap of the things that I have done the last two times I was able to present to you, and kind of put it together and go through some products as well. So I am Dr. Kimberly Smith Dotrieve. I am a board certified internal medicine physician. I practice in New Iberia, Louisiana. Um, Went to school in New Orleans undergrad for um, to get my bachelor's degree at Tulane University, and I went on to University of Louisiana at Lafayette and got a master's, and then went on to medical school. And so in the midst of all of this, had a baby boy who is no longer a baby. He's 27 now, but it was quite a journey. Love what I do. I don't like the healthcare system and the way insurances are. However, there's so much fascination with the body. And we talked before about the effects of CBD on the vascular system. And, the vascular system is throughout the body, from the brain all the way down to your feet. And so we just want to kind of go over some things and look a little bit closer at the heart and the brain. And we'll answer some questions after. So first up is this easy way of us looking at blood vessels. And so this is actually a test that we do in my practice. It allows for me to be able to actually tell a patient where their risk for heart attacks and strokes lies. This here gives you a very good look at what the blood vessel looks like through the different stages of inflammation. And so when you come all the way over here to the left, that is a normal blood vessel. The lining of the blood vessel is nice and thin and smooth. But with time, things happen. The first thing that we notice along the way is small particles of cholesterol start to get embedded within the blood vessel wall lining, and it causes the earliest stages of blockage that you can see here. What is crazy is that autopsies done on teens actually shows that itty bitty amount, we call it intimal thickening and plaque formation, that itty bitty amount we actually have been able to see in teenagers, which is horrible because this is just a testament of how we need to truly get back to healthy eating, regular exercising, especially with our children, because now we're in an age where kids spend so much time in front of the television, on their phones, on computers, playing video games. They do not get the exercise that they need. And when you are exercising, you are increasing your body's natural ability to decrease inflammation throughout the body. So when kids are just sitting there not doing much of anything, we're taking away their body's natural ability to reduce inflammation. But not just that, they're sitting there and they're munching. And of course, we know they're not munching on celery sticks and carrots, right? They're eating their fill of junk food. I remember having conversations with different families about their loved one being significantly overweight. And I hear so much, but how am I supposed to stop them from doing that? Well, the answer is really simple. You just don't buy it. You just don't have it accessible in the house. And that will take care of a lot of it. So the first stages of the earliest blockage we see with these small particles of cholesterol, because what we typically look at in blood work that you get as baseline blood work from your physician, we look at the regular cholesterol panel. So you have your total cholesterol, your good cholesterol, your bad cholesterol, and the triglycerides. Well, more than that, we need to know the small particles of these different cholesterol molecules. Those are big molecules, but those big molecules are made up of small lipoproteins, which are actually responsible for invading this blood vessel wall lining, causing the earliest stages of blockage. The next thing that happens is that the inflammatory markers, the stronger inflammatory markers, then start to rise in their levels, and they too stimulate that endothelial thickening and plaque formation that we see in the next different sections here. So the HSCRP is heart-specific CRP. This inflammatory marker is more specific to the heart muscle. And whenever that number is elevated, you're really seeing a person who probably has mild to moderate risk in heart attacks and strokes. So when that number is elevated, we want to work on getting that number down because we want to have risk as low as possible. And then the myeloperoxidase here, when that number goes up, you have significant blockage, probably a very, very vulnerable plaque that's on the verge of bursting. And finally, you get the clot over here that causes the complete occlusion or closing up of the blood vessel or blockage of that vessel. So if you can imagine blood flowing from the left to the right, blockage here, when that blood gets to this area, it's blocked and is unable to get on the other side of that blockage. When it is unable to get on the other side of that blockage, whatever muscle is on that other side is going to be damaged. Now, keep in mind, blood is how oxygen is transported throughout the body. So oxygen deprivation is the problem. When our muscles, what different organs, regardless of what they are, when they are oxygen deprived, that is when you're going to see damage to those different organs. It can happen in the brain, it can happen in the heart, it can happen in any of your organs, but oxygen deprivation is the problem. When you think about this, think about your sink being clogged. So when you have normal kind of mundane activity, you're not really doing much, your blood flow is just kind of, going at ease. And if you need to put a number on it, think of blood flow throughout the body in the terms of a speed limit. So let's say naturally our blood is flowing at about 20 miles an hour throughout the body. So think about that as being on a low pressure when you have your faucet on and it's clogged. So if the pressure of the water is low, at a low pressure, you don't get the backup. The water will go down pretty smoothly, even though there's blockage. But when you increase the pressure, when the water flow is at a higher pressure, then you get the water backup. The same thing happens with this blood flow. As long as the blood flow through this blood vessel is nice and smooth, not too fast, 20 miles an hour, the blood might flow through okay. It might be able to squeeze through this little area up here. But during activity, when the blood flow speeds up, the same thing that happens in the sink happens in the blood vessel. The blood is passing too quickly and it's coming too fast that there ends up being that block. Not enough blood can get to the other side. And that is when you see the muscle on the other side of that blockage start to become, damaged. It's in trouble because it is not getting the oxygen that it needs. So let's look at that when we're talking about the heart. So here we see the heart. We see right here in the center, this is our heart. And don't worry about all the letters. What I really wanted you to see here is that on top of the heart muscle itself, we have coronary arteries. And the coronary arteries are the arteries that are responsible for providing blood to the heart itself. Now, we know the heart as the pump of our body. It pumps all the fluid in our body is pumped through the heart. Well, the heart itself does need some nourishment, and it needs blood. So blood and oxygen. So these coronary arteries serve to provide the heart with the blood and oxygen that it needs. So whenever one of these arteries is blocked, as I showed you in the previous slide, that is when you potentially can have a heart attack. If this one over here is blocked in any place, then it puts the right side of the heart in danger. This one right here is actually the left anterior descending, and it is that one that I'm sure you've heard, the widowmaker. That is the artery that is associated with the widowmaker. When this LCA is blocked, it really cuts off the blood flow to the front of the heart, and that is a major thing, because when the front is not able to contract and relax the way it's supposed to, you end up with heart failure. And if it's a big enough area that gets damaged, it's probably going to lead to full-on cardiac arrest or a rhythm that is incompatible with life. So over here, when you look at this normal heart, you see it looks nice and pretty, of course, from the picture, but you're looking at the pink, that's showing that the heart muscle is just good. Over here on the right-hand side, you see that LCA, there was some kind of blockage that happened. Something kept that blood flow from going through. There's a clot there, and it led to the damage of that tissue right here at the bottom, the front and bottom. So that's what happens when you have a heart attack. Just remember that it's a lack of oxygen to that muscle. And wherever that blockage is, on the other side of that blockage, that's what muscle will end up being damaged. So when you look at the brain, you get pretty much a similar thing. Here, up here, I just put a picture of the circle of Willis. This is actually how the blood flows through our brain, through this whole circle of Willis. We have, this would be the back, where your spinal cord is. Here, the middle cerebral arteries, you're gonna get it from right here with the carotid arteries. From the carotid arteries, they'll go up and they will provide the blood that's flowing through the circle of Willis. And when you have blockage there, you end up with a stroke. Same thing. When there is blockage, this here on the left-hand side, you have a nice normal brain from this MRI image. On the right side, you can see right over at the right lateral side, that dark part here, that's where there has been damage to the brain because blockage was seen on that side, and that part of the brain was oxygen deprived for a long enough period of time that it damaged the muscles, or the tissue in the brain. So why is this important? This is important because the whole purpose of us being here is to understand the effect of CBD on the vascular system. And, the more I read, the more I research CBD, the more fascinated I am, I have to be honest, because these are still things we never learned in medical school. And so learning that a simple herb, from that simple herb, we get so many health benefits. It is absolutely amazing. And in my practice, I've been able to see so many wonderful changes in my patients, which we're going to talk about tonight. So when you look at research, you can go to PubMed. PubMed abstracts are, I think, available pretty much to anyone who wants to look at them, but there are quite a few different studies on CBD and how it affects the body, particularly the vascular system. One of the most common things that we know now is that CBD is a natural vasorelaxant. Sometimes you hear it said as a vasodilator, but pretty simply put, if you have a blood vessel or an artery, it will open it up. It will make it larger. It makes the diameter larger. And so when you think about blockage, if we can open up the blood vessel, then it allows the blood flow to go around that area of blockage. When you think about blood pressure, if we can open up the blood vessel, because blood pressure is higher because there is more resistance. And if you think about that blood vessel just being really, really tight, then, or think of it as like if you're on one side of a door and something is impeding you from going through that door, how much more pressure you're going to have to use. That's what's happening with higher blood pressures. Well, CBD will bind to the blood vessels and cause that vasorelaxant effect, or the vasodilation effect, open up those blood vessels and help the blood pressure to be lower. So the first thing is the vasorelaxant property, which is awesome because when you think about blockage, if we have CBD on board that can open up a vessel a little bit more than what it already is, allowing better blood flow, then you're getting the oxygen back to that area that's been deprived quicker, which is what we want in every situation for heart attacks and strokes. The faster the intervention, the faster we're able to restore the blood flow and the oxygenation of those muscles, then the better off that person is, especially when you're thinking about the long-term consequences. Whenever we're talking about complications, most of these complications are happening because there was a long enough time that that muscle or that tissue went without having any oxygen. So we want to prevent that. And it looks very promising that CBD will be one of the things that truly helps to make that happen. What else does CBD do? It also protects against vascular damage in diabetics. That's one of the things I talked about last week. When you look at diabetics, and remember, again, there are still no human studies. However, we have enough animal studies under our belts to know exactly how our different organs can be affected by different situations and circumstances. Well, I shared last week that rats that were diabetic, who had blockage or simulation of heart attacks and strokes, pretty much had that type of damage to the heart and brain that we saw in the previous slide when the rat was not on CBD. It was the natural thing that we typically see in people. Well, rats who already had CBD on board, who were diabetic and went through the same situation of blockage, impedance of the blood flow, and therefore the oxygenation of tissue, when they had CBD on board, those same tissues did not have any long-term complications. No, it pretty much helped or protected against the vascular damage in diabetics. So when we talked at the beginning and you saw that blood vessel and you see the inflammatory markers and those small particles of cholesterol invading the blood vessel wall lining, causing inflammation and damage, when CBD is on board, CBD is protective and helps to protect the blood vessels from going through that damage protocol that typically happens. So that's definitely another perk, because when the inflammatory markers start to increase, that is when the blood vessel lining becomes more and more vulnerable, more more easily broken through. Platelets start to aggregate and build, and that's where that plaque starts to form. And the more it's allowed to build, the more blockage you get. So to have CBD on board and protect against that is an absolute positive. What else can it do? It protects against ischemic damage. So ischemia is when the muscle is not able to get enough oxygen, and you get damage based on how long the oxygen is deprived from that muscle. So when there is oxygen deprivation, when CBD is on board, CBD is protective of that muscle and protects it from the overall damage that could have occurred. And so again, another perk. We talked last week about the effects of CBD on the brain and diabetics, and it was one of the things that the study showed. When you have a rat that has diabetes, and they have oxygen deprivation to the brain that could lead to a stroke, the study showed that for rats that had CBD on board, the brain integrity was maintained. They did not have the memory deficits. They did not have the cognitive deficiencies seen in those that were not on CBD. So the ischemic damage that we get protection from is coming from the CBD protecting the muscle from the overall effects of not having oxygen for a while. And last, I mentioned it just a few minutes ago, the positive effects against platelet aggregation. You know, when I say platelet aggregation, think of a scab. Whenever you cut yourself, platelets are what come into play to bind to that area, and they start to clump together to form a seal to stop the bleeding. Well, in blood vessels, as inflammation starts to increase, that is what I want you to have a picture of in your mind. The higher the inflammation in the body, the more fragile, the more the blood vessel lining becomes friable and thins. It becomes weepy with the bleeding. The platelets start to aggregate, trying to stop the bleeding. But the more inflammation you have, the more bleeding you have, the more platelets that are formed. And so that whole syndrome is what leads to the blood vessel being blocked. Well, if CBD is on board, it prevents that platelet aggregation. So it prevents the scabbing within the blood vessel. And that prevention is what keeps at least in the case of the rats, it keeps them from having that full-on occlusion or full blockage of that blood vessel. So these are things that are very, very good for us, because all of our studies pretty much start with animal studies. And from the animal studies, they are then moved over to human studies. So I believe that pretty soon we are going to see more studies done with humans. You're going to start to see them advertising to see who wants to be in these different studies, because the effects of CBD on the vascular system are very promising. We're talking about a simple herb, a natural resource that has the potential to protect our muscles, even in cases of heart attacks and strokes, protect our blood vessels from blockage in the first place. And it also has the ability to open up and relax and, one, lower your blood pressure, and then two, open up in cases of blockage to allow more room for the blood flow to actually occur to the rest of the musculature. So these are wonderful, wonderful findings in the animal studies, which hopefully in the near future we will see with human studies. And so the next thing we're going to do is talk about products. However, I would like to talk with Ms. Janine, if y'all don't mind, before I go any further. So Ms. Janine is actually the reason that I am
Yes, ma'am.
a part of Wakana. Ms. Janine here is someone that I've taken care of for a very long time. And it was because her blood sugar and her blood pressure were remarkably better than previous, that, I mean, it caught my attention. And even though when she came in and she said that it was Wakana CBD, and I did tell her, no ma'am, Pam, that it can't possibly be from
What
CBD.
kind of snake oil you got?
Well, it actually was from CBD. And what I pretty much did is I did my research. You know, I think I have a wonderful relationship with my patients. And if she felt like CBD was the reason for her improved blood sugars and blood pressures, then I wanted to find out, okay, how can that be? So, Ms. Janine, can you unmute yourself and just kind of give us, you know, just a little bit of history of your before CBD and after CBD, and, you know, whatever it is you'd like to share with us.
Sure thing.
I can't hear you.
Can you hear me?
Is it
Can you
just
hear
me? Can y'all hear her?
We can hear her.
Okay. Can you hear me, Doc?
Okay. Yes, it was me. Go ahead.
Okay. Yes, I mean, I was all out of control, and healthcare providers are the worst when it comes to managing disease processes sometimes, because we take care of everybody else, but a lot of times neglect to take care of ourselves. So when I did discover the Wakana CBD and started using it, I was like, oh, okay, well, you know, I like the way it made me feel as far as the energy, sleeping well at night, and so forth and so on. And I was reluctant initially to try it because I did try a CBD from a a friend before, and it just didn't work well with me, and it was a little bit too pepperminty, and you know, had heartburn all night, and I'm like, is this all that it's gonna do? And I'm like, my goodness. But when
It definitely wasn't a crown jewel of CBD, huh?
no, it was not. No, it was not. So I said, well, let me, you know, since I bought into the company, I said, well, rather than just let it sit there, because they sent me this big box of products, and I was like, okay, I need to, if I'm going to at least attempt to sell this or tell people about it, I need to know what it's going to do. And so when I started feeling better and my blood sugars were better, I was like, okay, wait, what's going on? Is this really true? And I started doing a lot of research behind it. And then I was like, oh, okay, something's happening. And so my blood pressure wasn't terribly bad before, but it was always on the borderline. And doc would say, you know, you need to watch. And I was like, okay, I'm watching. And now it's like blood pressure is normal within the AHA range, and my blood sugars are coming down, A1C is coming down, and I'm talking blood pressure 110s over 70s, you know, when it was before, like maybe 130s over 80s, somewhere around there. It hit 140 a couple of times, but I mean, I'm in the 120s, 110s now without any other Western or FDA approved medications on that. And I do my pure drops in the morning, my pure drops before I go to bed, and I do a half a gummy also too with that as well. And
Pure as well, right?
it's
Pure, the pure gummy as well, right?
Yes, the pure gummy as well, because I'm could be subject to random drug screens. So, you know, I use the pure products, which they work beautifully, you know, and blood sugars, blood pressure. Blood sugars are coming towards target now, you know, just it's Halloween time. So sometimes, you know, me and chocolate have a love-hate relationship. So I have to be mindful with that. But for the most part, blood pressure's fine. I feel much better. And I guess this is a surprise to you, Doc. I almost want to see when, because you talked about the vascular system this time. And so I'm like, I'm curious in the next 3 months to rescan my leg, which I did have like just some slight blockage, just from just, it's not anything major, but
Nothing
I just
major, but just go. I'm so sorry. I was saying nothing major, but we don't want any blockage.
yeah, exactly. That's it. And so I was like, okay, I said, let's scan that sucker maybe in the beginning of the year and see, because I would have been on the regimen at least a good 9 months,
That's
you
right.
know. And so I was like, okay, well, let's see. So, you know, I'm a living testament of the product. I am a product of the product, and I definitely wouldn't have ever brought it to my physician unless I saw that there was a benefit to it, that it did work, and that, you know, it truly, it's, you know, we're not talking snake oil here. We're talking, you know, pure CBD, good quality products, you know, like they say, the crown jewel of CBD.
That's right. And you know what? I would like to honestly encourage everyone on this call. Do not be afraid to talk to your physician about CBD. The bottom line is this is your health. I love talking to my patients because they know their body better than I know their body. I know the science, but they know their body. So it's a team effort. You may have some docs who don't want to hear it, but I'm going to tell you this as well. I am a strong proponent of you seeing somebody who has your best interest at heart, someone who will listen to you, someone who will have time to actually hear about why do you think CBD is working. And so again, I am very grateful to Janine for bringing this to my attention, because
Thank you.
let me tell y'all this too. The other thing about this CBD is that she was taking it. So she is what we call being a product of the product. She took the products. I noticed, because she didn't just walk in the office and say, hey, I'm on CBD, my stuff is better. No, this was, I'm like, okay, what's going on? How come
I
your
didn't
numbers
tell
look better?
and initially,
Yeah,
I was like, what you did different? She said, wait, what you did different? Your numbers, And she pulled the other ones to see if it was a mistake. And she's like, wait, what are you doing? And that's when I told her, and she was like, can't be. And I was like, yes, ma'am.
So you cannot beat the facts. That is what I would like for everybody to understand before I go through the products. You cannot beat the fact that I know your numbers were one thing before Wakana CBD, and I know what they were after. So doing the same thing, being a product of the product and going to see your physician and having your physician be a little bit amazed that, oh, you looking really good, and you being able to drop that Wakana bomb on them, that is a perfect way for you to get your physician involved, and also help with us older doctors, because remember, CBD was legalized in 2018. So it is safe to say any doctors who came out of med school in 2018 or before,
or even nurses or nurse practitioners, they didn't teach about them.
Nobody. And we just heard maybe about a month ago that pharmacy schools and medical schools are now implementing the curriculum to include CBD. And I'm pretty sure they're doing it for nurses and providers and everybody in healthcare, because it's going to be an integral part of what we're doing. So thank you, my dear. I appreciate
You're welcome.
Thank you so much. All right, so now we are going to talk about some products. Let me share my screen with you all again. I hope this was interesting for you. So we know that Wakana is the crown jewel of CBD. Our awesome company has a wide variety of different products for different uses, all of them with the common denominator of CBD, because it is from CBD that we get the anti-inflammatory properties, the antioxidant properties. But Wakana has made sure that we are able to have products in different industries that are booming throughout the world, for us to be able to use and to provide others with, to help them feel better. As we were talking about before, Janine actually takes just the pure products. The pure products have 0.0% THC. Now, legally in all 50 states, you can have up to 0.3% THC, and that's a federal law. And so our power products have that 0.3% THC. Anyone who has to do drug testing, you want to stick with the pure products. And remember what Janine said, even without the THC, the CBD alone with the pure products work phenomenally. But you also want to remember, she tried CBD before Wakana CBD. All CBD is not the same. Wakana truly is the crown jewel of CBD, and the high quality, high purity that we get from these products is what allows us to see these wonderful health benefits that we've been able to see. So first, let's talk about the different types of products that we get. This is our power line. But as you see, there are different products that we can get in the power line. First, we have the Power Hemp MD, which is our strongest tincture. The tinctures we put under the tongue, we start off with 3 drops under the tongue, let it sit there for about a minute or 2, and then we swallow. Tinctures get into the bloodstream in about an hour, and they last for about 4 hours. But we can use tinctures for a wide variety of medical issues to help with sleep, help with anxiety reduction, help with stress, help with focus, help with reducing inflammation throughout the body so it can help with pain. The gummies, our power gummies can do the same. You see on the bottle, it says sleep, sex, and inflammation. It can help with all of those things as well. But with the power gummies, we want to start with 1/4 of a gummy. I don't care how many gummies you've tried from how many other different places. Nothing compares to the gummies that we have. You do want to start with 1/4, please. Now, when you take the power gummies, they will get into your system in about 4 hours, and they will last for about 8 to 12 hours. The premium flower are smokable, or it could be used as a dry herb in foods, like in salads or in smoothies. But in a smokable form, it is the fastest way we can get CBD into our system. So we have the flower, and you'll see later we have pre-rolls and vapes as well. But the flower will get into your system in about a minute, and it will last for about an hour. And then we have the Power Extreme Pain Cream. This is my most favorite product. I call it my miracle cream because to date, every single patient I have put this pain cream on, they have all felt some reduction in their pain. And it is a hit. It is such a great feeling to have someone who has not been able to comfortably bend their knees in the office, literally with their leg in the air, flapping their leg up and down because they can't believe how they're able to bend their knee and not have severe pain. So what we do with these products is something called layering. If you're someone who has chronic pain, you want to use the products morning and evening so that you have a lasting effect. And remember, I talked about the onset and duration. So you take all of them, use them all at the same time, morning and night. And you have, let's take the pain cream and the flower. The flower will be in your system in about a minute. The pain cream will be in your system, get to your aches and pains in about 5 minutes. Both of these are gonna last about an hour or so. The pain cream, I've seen it last a little bit longer in different individuals. But when that is wearing off, the drops are kicking in. Because remember, the tincture kicks in about an hour. It lasts for 4 hours. So when that is wearing off, the power gummies are kicking in then at 4 hours, and they will last about 8 to 12. That is layering. So if you have a chronic issue going on, like Ms. Janine here, she uses her pure products morning and evening because she wants a continuous steady state of CBD in her system to continuously work on her blood pressure and her diabetes. So same thing, we want to do that for different chronic issues that we might have. Wakana also has a wide assortment of gummies. The first we're looking at here, the King of the Jungle. The King of the Jungle is our absolute the trophy, the one that we talk about a lot because it really sells quickly, number one. Number two, it boosts your libido, increases your stamina, and is a very, very good alternative to Viagra. When you think of King of the Jungle versus Viagra, we're worried a lot about Viagra when we're talking about blood pressures dropping too low. Some people have had sudden cardiac arrest. King of the Jungle, you don't have to worry about that. We say King of the Jungle, but it can be Queen of the Jungle as well. Good for men and good for women. The star of our sexual wellness line, which you will see in a few. The Flight Delta 8 gummies, these are our strongest gummies. These are the most similar to the real deal, to the THC. But these are legal in all 50 states. The caution sign is because it's so similar to THC. If you've ever had an issue with THC, you want to steer clear. However, if you have not, this is something that actually has been very, very helpful for focus. My patients with ADHD do really well with the Flight Delta 8. It gives you that creative edge, more focus, more concentration. But you know what else this did? This helped my patient who broke her humerus. She broke her arm all the way up here. Norco wasn't taking away that pain enough. Percocet didn't take the pain away enough. But when she tried the Flight Delta 8 gummy, she said it took the edge off the pain, and finally she was able to at least sleep at night. So I think that what we're going to see with the Delta 8 products in the near future is a very good alternative for the opioid epidemic that we're faced with. We have the Pure gummies. Remember, Pure gummies and Pure products have 0.0% THC. So if you have to do drug testing, you want to stick with the Pure gummies. And they will help with all of these things that we've mentioned, with the sex, with the inflammation, with the sleep, with the anxiety. It just has 0.0% THC. And here again, we have the Power gummies. If you're wondering, because I get that question as well, what's the difference in Pure and Power? Well, that little bit of THC that you find in the Power products actually helps the CBD work at its strongest properties. When you compare how you're taking it, when you take Pure products, you might end up taking maybe a half of the gummy as opposed to a fourth with the Power. With the tincture, you might use maybe 6 drops of the tincture of the Pure, but only 3 with the Power. They will both get you where you need to go. The Pure product, you might have to use a little bit more of it versus the Power, but they all will work just as fabulously as the others. We have culinary products, 3 different seasonings that taste absolutely amazing. We even have here the CBD butter that you can put on your breads. And we have the drops here on both sides that are used for infusing drinks and foods. So we have the culinary line covered. Very good way for you to infuse CBD with your foods and get the benefits that they have. We have the Royal Defense line, a full line of products that we need, especially now in COVID season. So there are products in here for your body itself, for defense. The first defense, nasal spray, fabulous. My daughter, who suffers with chronic sinusitis, literally said she got instantaneous relief. And so this is a product now that I got the congestion not long after, so I could try it myself. It works. It absolutely works, and it works for a long time. So we have protection for our sinus passages. We have the Essential Defense here that you can put on your toothbrush to help with the germs and bacteria in your mouth. We also have things for the produce. Look, produce wash here, because please, please, please be washing your fruits and vegetables when you buy them from the store, since you have no idea who's been touching them. But there's also something for the hard surfaces, something for the hands. The Royal Defense line is taking care of all of the needs we have when it comes to protecting ourselves against germs and bacteria and viruses. And this line is alcohol free. It kills 99.9% of the germs, works up to 24 hours, which is a very good competitor for the microban. And it's lab certified and it is all natural. Wakana has its own line of essential oils. You have to be living under a rock if you've not heard of essential oils. And you're able to get, again, like with the CBD, the highest quality and the purest products that we possibly can get. The black seed oil is the one that we always kind of spotlight. I never knew black seed oil could do so much, but it actually helps with upregulating the beta cells in the pancreas and helps it to produce more insulin. It helps, it's an antibacterial, it's an antifungal, anti-mold. If you're not very familiar with black seed oil, definitely something that you would want to get more information about because of its many, many wonderful health benefits. My husband used this on his tooth abscess. Waiting to get to see the dentist, he started putting it on there and he said it actually numbed or dulled the pain quite a bit for him to be comfortable. So great things with the black seed oil. Here we have more of the smokables. We have the pre-rolls and we have vapes. Again, the fastest way to get CBD into your system. And here we have the full line of sexual wellness products. Great wedding gifts. I got this from Dr. Rita some weeks ago, and it was just like the light went off. Great products to give to spice up your sex life, to spice up your marriage, to just kind of, spice things up in general. Here again, you have the King of the Jungle, but there's also the G-Spot CBD lube, as well as the Cherry Bliss, which is an edible. There is body butter here that you can put on in different scents, including over here the mango and the oud body oil, which one of our business partners, Ms. Monica, actually talked about this maybe last week, gave a great testimony of how the oud body oil, after she put it on a rash, it almost instantaneously stopped her itching when she was already using the steroids that weren't helping. So again, we can expect this from Wakana products because they are high quality products. Then we have the weight loss and immune defense system products that come in a package as one for our gummy challenge. Sorry. So first, the detox tea, which helps with cleansing your colon, because we have to start with a clean colon if we want healthy weight loss. The detox tea will get the balance of the good and the bad bacteria where they need to be. It enhances metabolism as well, and causes us to absorb the good nutrients and supplements that we need. We have the Flat Belly Brew coffee here, which is loaded with CBD, but also Garcinia cambogia, which helps prevent too much fat storage and absorption, and the green tea, which also will help to boost our metabolism. The Flat Belly Gummy is one of our newest products. This is an amazing, amazing product. I just had someone to sign up because she tried some different things, but her sister called and told her that she literally had much better control over her appetite since she started using the Flat Belly gummies. And for the lady, this is actually one of my med school classmates. She said her sister had been dealing with this for a minute. And for her sister to really love this, it had to be working. These three products you can get in the Flat Belly pack. Ask the person who invited you to the Zoom about that Flat Belly pack. It works. It will get you on the road to healthy weight loss. And back to like the Royal Defense line, we actually have the immune defense tea here for boosting your immune system, because again, in this day and age, with COVID still being a major player, we want to have our immune system as boosted and as powered up as we possibly can. King T'Challa. The King T'Challa is our only capsule, but it is a power hitter here. So much we get from this product. The chaga mushroom, loaded with health benefits, but it is a strong anti-inflammatory, antibacterial, antioxidant. It's anti-tumor growth, boosts your immune system, but it also lowers blood, helps with lowering blood sugar and cholesterol levels. I mean, when you talk about a power player, the King T'Challa is it. This is one of those supplements that I tell patients they all need to be on. If they are able to, they should be on it, because it is the one product that gives you a bit of everything that you are looking for. And our hair care line, we have the Hemp Power Hair, which are drops that you can put on your scalp and rub it in. It'll stimulate the follicles and help with getting hair growth where there was none, where there might have been some hair thinning. And it'll help with you growing longer, stronger, healthier hair. For men who are looking for that beard to be fuller and healthier, we have the beard and scalp oil. But the main thing to get from these two is that we're strengthening the follicles so that you get healthier hair growing. Combining that with our S.O.S hair care system is absolutely amazing. I myself have a great success story. I had a lot of hair loss after a tragedy that I'd gone through a couple of years ago. And I'll tell you, when I comb my hair every day, there were so many strands on the floor that I was just kind of wondering how I even had any hair on my head left. Well, when I started using the Hemp Power Hair and the S.O.S care system, when I tell you it was a game changer, it was a game changer. Stronger hair, fewer, much, much fewer strands on the floor. My hair is thicker, it's healthier, it's stronger. I am getting so many compliments now. I don't think people realized how thin my hair had gotten. And so now they're looking at it and they realize, okay, something is different. Like, oh, your hair looks good. And I'm getting the compliments again, because S.O.S to the rescue, Save Our Strands hair care system. All of these different products included the shampoo, the conditioner, leave-in detangler, the hair cream, and that oud body oil, which you use on the hair for the sheen. Helps for you to have, again, longer, stronger, healthier hair. And so all of these products, they're phenomenal. I want to tell you, this has been one of the best decisions that I have made in my career in implementing this in my practice, because it has already brought such life-changing effects for my patients that I'm overjoyed. When I tell you, we have people living a better quality of life, they are living a better quality of life. People who were not really active because of pain, the pain is so much better. People who were having trouble sleeping, they are sleeping through the night. I know I gave y'all this story about my patient whose blood pressure came in, it was 192 over 120, I think it was. After a couple of weeks, and she was taking 3 different blood pressure medicines. 2 of them were twice a day, 1 was 3 times a day. She started the drops and the gummies, came back 2 weeks later, she was like 120s over 70s. But she had to take herself off of one of the doses because taking it 3 times a day, she was dropping too much. When she came in that day, she hadn't taken her medicine yet. So I had to go down on the dose even more. Well, I saw her again a couple of weeks ago, I want to say, and this is 3 months later. She's only taken 2 of those pills at night, once at night. That's it. So that is mind blowing. I don't know how, I don't know what you guys think about it, but that is absolutely mind blowing for me. Oh, I left her on. I'm sorry. So I will open up for questions. We only have 6 minutes left. Let's see what we have here. I don't know if Miss Lisa, if you were able to.
Yes, Stanley's question was, can the muscles be repaired if treated once you have that oxygen flow deprivation?
Unfortunately, if there is damage, then the damage is irreversible damage. Now, when you think about that kind of damage, let's talk about damage in the brain. When you think about there being that damage, then you can reteach, if it's not too bad. If you think about damage on a scale of 1 to 10, if the damage is a 10 out of 10, then very unlikely that there's going to be much restoration of activity. If it's a 3 to 5 out of 10, then there's a possibility that you can reteach what is still healthy to do what you needed to do. So if you think of somebody who had a stroke and they're unable to move their arm, you can do rehab and reteach the brain that is still healthy to be able to control the arm that is affected by the damaged part of the brain. Cardiopulmonary rehab we have for the heart and the lungs that have some damage. What is damaged is damaged. You can't change that. However, you can work around the damage and use what you have left that is healthy to do the job that that damaged area was doing.
And second question, Doc, is there a way to find out if you have any blockage?
Yes, actually, the definitive way to find out if you have blockage is actually with an angiogram. The angiogram is a procedure that allows the cardiologist to go through your artery. It takes him straight to your heart. While in the heart, he will shoot some dye in there and look at those coronary arteries that are on top of the heart. Remember I said the heart needs to be fed as well. The arteries on top of the heart, which are giving the heart the nutrients it needs through the blood and oxygen, the dye goes through them, and you can see on the monitor whether there is some type of blockage or not. You're either going to see just good blood flow, or you'll see that the blood flow is good, and then there might be a little bitty amount of blood flow, and then it might open up again. So areas where it thins out, that's where there's probably some blockage, but you do need to talk to your cardiologist about that. The cardiologist is the only one who can do that angiogram. There are non-invasive tests like the stress test that can kind of give you an idea of whether there's some stress going on to the heart or not, but the definitive way to know is with an angiogram.
That was the last question, Doc. Someone had a comment. We have 2 minutes remaining. Someone had a comment about their provider not receptive to CBD. Any recommendations?
That the provider is what?
Not receptive to using CBD, their provider?
Well, then you have to ask yourself, is this the right doctor for you? I mean, honestly, that's all I can really say. I'm not promoting that you just, jump ship and get another doctor, but you do need to make sure you have a doctor that is willing to sit and listen to you, listen to your concerns, hear you out. So, you just might need to just take a moment, maybe check somebody else out and see where they are when it comes to CBD. But at the end of the day, patients bring things to me all the time. And as a physician, I have to do my part and listen and research. Is it worth it or not? I can't just ignore it, so you just might just think about that. Maybe just get a second opinion from somewhere else. But you want a doctor that is for you. So it is right before the 8 o'clock hour. I'm going to jump off so Dr. Joy Smith can get on. Thank you so much for being with me this evening. I hope that this has been informative. Good night.
Thanks, Doc.
Thank you, Janine. Thank you,
You're welcome.
Lisa.